Hello and welcome. My name is Suzanne Norris and I'm the facilitator for the Senior Compass Project with the NEMI Public Library. The Senior Compass Project is funded by the New Horizons for Seniors Program Employment and Social Development Canada. This program provides funding for projects that make a difference in the lives of seniors and in their communities. Today, we will be speaking about the importance of keeping the mind active. This webinar is the third of a series of information videos directed at accessing services and support in our community. I would like to welcome Jessica Bertuzzi from Sudbury, Ontario. Hi, Jessica.
Hi, everyone.
Jessica is the Public Relations and Education Manager with the Alzheimer's Society, Sudbury, Manitoulin, North Bay, and districts. She has been with the Society for 10 years and has worked on numerous national and provincial committees to help support and develop dementia-friendly communities. Jessica also manages numerous local programs with the Society, including recreation therapy, health promotion, public education, support groups, and community engagement. Not only does she have the professional experience, but also uses her lived experience to further educate and support those living the dementia journey. You've done lots there, Jessica, in the 10 years that you've worked with the organization. And thanks for joining us once again for this webinar. I think, first of all, I'd like to sort of get you to talk about all the programs that you yourself are offering with the Alzheimer's Society to start. And then the other one, just to sort of expand on the comment at the bottom that you gave me about you living with, experience in your life with dementia. And when we were speaking with it before, you had mentioned that quite a few of the people who work with the Alzheimer's Society actually have personal experience with it. So if you want to start out just expanding that a little bit, that would be great.
Yes, for sure. Thank you. So we at the Alzheimer's Society have a numerous amount of programs and services that we offer for not only care partners, but for family members, friends, but as well for the person living with dementia. So we kind of break it up in three sections. So we have our clinical team, and our clinical team is typically made up of nurses and social workers. Our clinical team helps families along their journey with supportive counseling, support groups. They also perform cognitive assessments, which can be done either in our offices or in the homes of the person living with dementia. We also have our community programs. So programs that we offer within the community, and that involves health promotion, recreation therapy, in-home activation. We have a bunch of different programs from our Minds in Motion, art therapy, walking groups. There's a number of them. We also have our day programs. So our day programs are offered in right now, Sudbury, North Bay, Powassan, Alvin, Noelville, Espanola, and then we have kind of a day program on Manitoulin Island as well that we've kind of changed its design to be open to anyone. So they don't just have to be living with a diagnosis of dementia, but this day program is available for, it's kind of a drop-in center where people can receive activation and support from our two staff on Manitoulin Island. So we have a number of programs and services available.
Wow, that's really great. Yeah.
To answer the second part of your question, something I really always like to make note of when I'm talking about our staff and our programs and services. So one thing that's really unique about our organization is the majority of our staff, I would say probably around 75% of them, have lived experience. So they've had someone within their close circle who has gone through the dementia journey and that we've joined them with it. For myself, I came from a big, large Italian family, and, we thought we could take care of our grandmother at home for as long as possible. And we quickly learned the challenges and learned that we had so much to learn about this disease. And even though our big family thought we could do it, in the end, we couldn't do it as long as we thought. So one of the biggest things, and that's why I got into this field, was to learn more and make a difference and to help families understand that they are not alone on this journey, that there are a number of people out there to help support them. This journey can be very isolating, but it doesn't have to be with the right supports in place and the right people. So our organization understands that, and we're very much there to help support them on this journey.
Wow, that sounds great. It sounds great. So can we sort of start with the basic ideas and the definitions around, well, first of all, the importance of keeping the mind active. You and I spoke about the importance of activation. So speaking to the definition of what activation means to the Alzheimer's Society and somebody working in that field.
So when we talk about activation, there's three key pieces to it. So we're talking about being physically active, being socially active, and also being cognitively active. So these are three very important components to maintaining a healthy lifestyle and a balanced lifestyle. So that means our mind, our body, and our soul. And all of our programs at the Alzheimer's Society focus on that activation piece. So keeping everyone physically, socially, and cognitively active. Now, there's a bit of a twist to it because we try to ensure that this activation is also person-centered. And when I say person-centered, I mean designed to the person's likes or dislikes. So for example, if I never liked painting in my entire life, I'm not going to enjoy sitting with someone painting a picture. If I enjoy getting outside and going for walks, well, that's what's going to keep me activated. So person-centered activation means we're designing activities based on their personhood. So their likes, their dislikes, their past, their histories, their past occupations. It's really about making it person-centered, activation and care.
Wow. So when you interview a family and or a person, you must go through a pretty extensive history and basically their hobbies and what they did, before that's excellent. And I can see how that would be more successful than doing, the cookie cutter and one size fits all and come out here and because it would feel uncomfortable. I know personally, I know it's good to paint and be creative, but I buy the paint brushes and the paints and the sketchbooks, and I've got a lot of those in my closet that I should get out, right? But I don't feel comfortable with it.
Yeah.
So yeah. So that's good. Anything else you want to speak about that? You did speak about the physical, the socialization. Did you want to expand on those specifically, or?
Yeah, absolutely. So when I'm talking about physical activation, it doesn't mean that it has to be something strenuous. Physical activation could just be doing some chair yoga, getting outside for a walk. It doesn't have to be running a mile or doing exercise classes, nothing like that. It could even just be doing dances, going to social groups and dancing. It's just keeping your body active, because the old saying where they say, if you don't use it, you lose it, is very true. So we want to maintain their physical capabilities as long as possible. So that means we have to challenge our body physically. When I'm talking about socialization, again, it does not have to be complicated. It could be as simple as having a weekly coffee date with your friends or family, picking up the phone and having a conversation. It could be as easy as joining a new social group, a book club, anything like that. It's having that interaction with other human beings, having the opportunity to communicate with other people. Mm-hmm. This disease in itself is socially isolating, but as we age, we tend to socially isolate ourselves as we age. Why that is, I'm not sure. We just do. We stop doing things that we've always enjoyed. But it's important that we keep that communication with people. That socialization piece is very crucial to keeping our brain active. When I'm talking about cognitive stimulation, again, it does not have to be complicated. I'm not saying you have to pick up puzzles and do all these Sudokus, 20 Sudokus a day or anything like that. That's not the case. When I'm talking about cognitively challenging ourselves, it could be something as simple as learning a new hobby. If I've never crocheted or knitted, trying something like that. If I really wasn't an avid reader, trying to pick up a book and start reading. If I'm predominantly right-handed, well, I'm going to challenge my brain and start doing things with my left hand. And I do that now, right now, all the time. I challenge myself. So if I always brush my teeth with my right hand, every second day I switch it up and I use my left hand. It's simple things like that that challenge our brain and keep it exercised, keeping it activated. So again, it's not about making it complicated. It's just simple little things we can do in our everyday life to maintain the physical, social, and cognitive stimulation.